Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, February 25th, and this is our COVID briefing. We've now had 8,163 cumulative positive cases in Missoula County to date, with 29 new cases since yesterday. That's a little bit of a bump since we've been seeing more like 10 to 15 cases a day. We've had 82 deaths associated with COVID-19 to date, and we currently have 117 active COVID-19 cases. And there are 1 Missoula County resident and 8 out-of-county residents currently hospitalized in Missoula County. Our current average incidence per 100,000 people is still holding steady at 15. The state of Montana is reporting 99,445 cumulative COVID cases, which is up 201 new cases since yesterday. There are now 1,917 active cases with 75 active hospitalizations across the state, and there have been 1,350 deaths related to COVID-19 statewide. The University of Montana has had 661 cumulative associated cases since the beginning of fall semester back in August, with 3 new cases reported since yesterday. And there are currently 14 active associated cases. Today, I'm going to talk about the tiers used for prioritizing vaccine and where we're at with that, and also talk a little bit more about the Johnson & Johnson COVID vaccine. So we've been getting a lot of questions about when we're going to be moving to phase 1B tier 2. We don't have an estimate of that at this time, though we expect to have that information soon. Several factors, such as the county getting increased access to federal supply of vaccine, as well as news that Pfizer has cut production time in half and that more vaccines are likely be approved, has made us hopeful that the vaccine rollout is going to speed up in the next few months. The county's vaccine coordination team is currently working on getting an estimate as to when tier 2 will start, and that information will be made public to you as soon as we have it. So a lot of people are asking how many people are in phase 1B tier 1. Our current data suggests that we have roughly 16,500 people who are eligible in the first tier of phase 1B. Roughly 23,500 people will be eligible for phase 1B tier 2. Since the county opened up phase 1B tier 1 vaccinations at the end of January, more than 6,000 doses have been administered. When looking at the number of doses given for both 1A and 1B combined, there's been around 16,300 total first doses administered since vaccination started. And I just want to put that reminder out there that right now the county has been getting roughly 1,500 doses per week since the end of January. So next, let's touch on what we know about the Johnson & Johnson COVID vaccine. The meeting where they're going to consider the emergency use authorization for this vaccine will take place tomorrow on Friday. We do not yet know how much or when Montana would begin to receive the Johnson & Johnson vaccine, but we expect it will likely still be several weeks out. It is a single-dose shot, and it's not an mRNA vaccine like the Moderna and Pfizer vaccines. Instead, it uses a weakened form of the virus. Over 70,000 adults participated in the study of the vaccine across America, South Africa, and Latin America, and the clinical trials took place in a variety of places and settings. If approved, it will only be available to those who are 18 and older. And a recent study does show that the Johnson & Johnson shot is just as effective as the Moderna and Pfizer at preventing serious illness and death. At this time, we do not believe that patients will be able to choose which vaccine they get whenever they go into a clinic. People who sign up will just be offered whatever vaccine the clinic has that day, whether it's the Moderna, Pfizer, or Johnson & Johnson. So I'm keeping the briefing pretty short today, so that's it for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. You can click the notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can call 258-INFO for more information about COVID, for assistance in scheduling a COVID vaccine if you don't have internet access, or to schedule a COVID test if you start developing symptoms. And also check out our website at missoulainfo.com and check out the vaccine coordination team's website for more information about upcoming vaccination clinics at covid19.missoula.co. So that's it for today. Until next week, everybody stay healthy.